Hi, everyone. Thank you for attending tonight's presentation on understanding your child with autism spectrum disorder. Let's see if it'll switch. There we go. My name is Natalya Gutierrez. Before we really get started today, I would first like to share my story of how I got involved in the field of ABA. I'm a born and raised South Florida girl, and while I was in school earning my bachelor's degree, I worked at a large community pool as a lifeguard. And at this pool, we would have camps visit throughout the summer. For 4 consecutive summers, I would see the same camp come through with the same kids. And these kiddos had varying developmental disabilities, and I was lucky enough to get in the water with them to play or attempt to teach them how to swim. And right then I knew I wanted to do something full time within the special needs community once I graduated. So I looked up jobs on Indeed and found an RBT position. I wanted to get out of Florida, and I found a small ABA provider in Clarksville, Tennessee, who was willing to take me on. And towards the end of 2018, I made the move to Tennessee. And after extensive training, I began providing ABA services in the clients' homes and community. I absolutely loved my job as an RBT, so I then decided to go back to school to obtain my master's. And while I was in grad school, I worked at the ABA Research Clinic on campus, and in 2022, I graduated from Florida Tech with my master's in ABA and OBM. Since then, I have been practicing as a BCBA, specializing in early intervention, so kiddos ages 2 to 6. And Tennessee was calling my name again, so I am now a site director at the Autism Clinic at Hope in Smyrna, Tennessee. Now, let's dive into the meat and potatoes of today. What is ASD? Well, it refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. Moving on to the prevalence and importance of awareness. According to the CDC, ASD affects an estimated 1 in 36 children and 1 in 45 adults in the US. Boys are also 4 times more likely to be diagnosed. This is likely because males present more challenging behaviors in comparison to females, whether it's higher intensity or maybe it happens more frequently. It is also common for those with ASD to have multiple diagnoses, such as attention deficit hyperactivity disorder or ADHD, anxiety and depression, gastrointestinal disorders, along with seizures and sleep disorders. A lot of my clients have had the diagnosis of ASD and one of these co-occurring conditions. Now, with the information I provide for you today, I do hope that you all have a better understanding of autism. You learn the signs and symptoms, learn communication strategies, and ways to support social skills, manage behaviors, collaborate with professionals that are involved in your child's learning. And at the end, I will provide you with some resources. Again, this presentation is also being recorded and will be uploaded for you to reference in the future. Now, to help understand ASD a little more, let's begin by talking about the characteristics. 1, we have communication challenges. Some people with ASD are nonverbal. This would be considered limited to no communication skills. Then we have nonvocal. This is a term I typically use because a lot of kiddos may not use their voice to speak, but they learn to communicate in other ways. And then there are those who use gestures, such as pointing to items they want, or they may take an adult by the hand to lead them to where they want or what they want. A couple communication strategies for those who are nonvocal are PECS or an AAC device, which I'll go over more in a bit. Two, there are likely social interaction difficulties. So there may be a lack of eye contact, disinterest in being around others, or they may have a hard time holding a conversation. Three, we have repetitive behaviors and restricted interests. You may have heard of stimming before. This is the same thing as stereotypy, and it comes in different forms. So there's motor stereotypy. An example would be flapping arms or jumping up and down repetitively. There's vocal stereotypy. I used to have a kiddo who would hum when he was happy or feeling content. And then we have visual stereotypy, such as fast blinking or tracking items using peripheral vision, or even staring at bright lights. And of course, I do have to put an emphasis on the spectrum nature of autism. Those with ASD, either kiddos or adults, have varied abilities and challenges. So, nonvocal can look very different across each person with the type of communication strategy they use. How well they use that strategy can also determine where they might fall on the spectrum. For example, one kiddo might just be starting ABA therapy, learning how to request, while another can request or answer questions fluently using a device. Some may also engage in high intensity, high frequency challenging behaviors like aggression, self injury, property destruction, or flopping. But this doesn't mean that all people with autism face these challenges, or maybe they do face some of these challenges, but not with high intensity. To dive into the spectrum a little more, I want to discuss high and low functioning autism. Those who have high functioning autism generally have intellectual abilities within the average or above average range. Some strengths include having strong verbal communication and language skills. They are able to navigate daily tasks and responsibilities like school, or if they're older, maybe work. And they may excel in specific areas like math, technology, music. Some challenges these folks may face are understanding social cues, forming relationships and then maintaining those relationships, sensory sensitivities like light, sound, textures, and emotional regulation and executive functioning like planning or organizing. Then we have those with low functioning autism. These individuals typically have intellectual disabilities and may have more significant communication difficulties. It is common for more support to be needed in daily life with personal care like showering or toileting. Additional assistance may be needed for social interactions and daily living tasks like eating or washing hands, things that you would do in your everyday life. Those with low functioning autism still have strengths like repetitive tasks and routine. Some also have strong abilities in certain domains. For example, I have worked with a non-vocal client who has the ability to communicate with an AAC device, although he doesn't always love to use it. And he's around 7, but not potty trained. However, using his device, he can type out all responses and understand almost every instruction you throw his way without having to teach each of those instructions intensively. People with low functioning autism may face additional challenges, though. There may be more severe communication deficits, greater difficulty with self care and mobility, daily tasks, more significant social impairments, and they often have a harder time understanding social norms. However, I do want to emphasize that just because someone may be low functioning when first diagnosed, it does not mean it's impossible to move somewhere else along the spectrum. And we can even say become higher functioning. Each individual case is so different. So, of course, no promises can be made. And it would take a lot of work on everyone's part, including the providers, the educators, the client, and the family. But progress should be observed with the right tools and support. Now, let's move on to some signs and symptoms. In infants and toddlers, it's common to see communication delays, lack of eye contact, sensory sensitivities like light, sound, textures when it comes to play items or even food. And I should add challenging behaviors. So, a lot of behaviors are typically present due to the communication deficits. I would be frustrated too if I didn't know how to tell someone what I wanted or needed, or maybe when I attempted to tell them, they could never understand me. I might be frustrated and I might want to throw something. For kiddos in school, it's common to see difficulty with social skills like sharing and participating in group activities. They may be very rigid when it comes to routines and resistant to change in those routines. Sometimes when these changes occur, you might see an increase in challenging behavior. But all of these signs and symptoms can be worked on. That's why early intervention is so important. Kiddos can enter ABA services as early as 2 years old, given that they can be diagnosed as early as 18 months. ABA can play a role in helping a child reach milestones and decrease maladaptive or challenging behaviors, especially when there is parent or caregiver involvement. Involvement. The goals selected should also be age appropriate based on client and family goals, as well as assessment results. I do want to emphasize the goals being selected based on age appropriateness. For example, if I have a 3-year-old who engages in tantrums, of course, I want to be able to see how often they happen. But a typical 3-year-old is going to throw tantrums. So I want to set a realistic expectation, an appropriate expectation based on their age. I'm not going to say that I want tantrums to be eliminated altogether or that it's a realistic expectation, because a typical 3-year-old will throw a tantrum from time to time. So will I want to see it decrease if it happens 50 times a week? Absolutely. But I'm not going to say in my goal that it needs to be decreased or to zero or eliminated altogether. So you may have heard me speak of PECS and AAC devices just really quickly earlier, and I said I would review. So this is the moment. These are the most common communication strategies for our non-vocal kiddos. PECS is a picture exchange communication system. PECS users exchange pictures, symbols, words, or to request items, attention, or even to answer questions sometimes. This is also a prerequisite to using an AAC device. So for PECS users, we typically create a PECS book, which is essentially a mini binder, and all of the child's preferred items for categories like food, toys, locations like the bathroom or even a park. They will be in that PECS book. And the idea is that when they need something or want something, they go to their book, they flip through the pages to find whatever item it is they want. And these items are attached by Velcro. So they will then pull the item off of the page and go to an adult, hand it over, and this adult should be someone who can give them access to that item. AAC stands for Augmentative and Alternative Communication. It has the same concept as PECS, except instead of instead of handing over a picture item, they are going to select a picture on the tablet, like an iPad, and that tablet will then emit the sound or speak for the child. So many AAC programs, I just want to let you know, they do allow you to switch the voice. That way it doesn't sound like a robot or Siri. But you can change it to where it sounds similar to a small boy or girl. Some tips I can provide for effective communication would be to use visuals. Put up a visual schedule in your child's room or in a central location in the home, like the kitchen. Or you can even make it portable so that you can take it on the road with you. I do suggest having the visual schedule because it allows your child to see what the expectations are for the day, and that might make your life a bit easier. Transitions may be a little smoother. And if you're able to, I suggest having your child participate in preparing the schedule with you when it's appropriate, like on the weekend when you have a little more freedom. So, for example, on a Saturday, if I know I want to get 10 things done, or I want my child to do 10 things, instead of putting it in a specific order, maybe you can say, hey, I'm going to give you all of these items and I want you to place them on to your schedule. And your child gets to pick whatever order they want. Now, I would try not to make each day the exact same so that they don't become rigid in their routines. But it's good to introduce them to that change. In combination with a schedule, you can use a timer. So each activity is X amount of time. And when the timer goes off, it provides a signal that it's time to move on to the next activity or location. Another tip is to use simplified language. Break it down into clear, simple phrases and instructions. So I would want you to say throw away versus go put your food in the garbage. For those with little communication, we need to be aware of our own language first and just try to make it a little simple for them. And of course, I advise to practice patience and active listening. Your kiddo may need a few tries before they finally give you the correct response, or you may need to provide a little extra help or prompting to teach them the correct response. We can sometimes do hundreds and hundreds of trials just to teach one skill. It's common, so don't feel defeated if it takes you many, many tries. Next, we have supporting social skills. It's so important, especially if the goal is to have your kiddo go to school, to surround your child with people, especially similar age peers, and promote social activities. By doing this, you can help increase skills like imitation, which in return may expand their play repertoire, and increase motivation or the value of different activities. A lot of our kiddos are only interested in few items. So having that imitation, they're then able to mimic their peers, and it might open the door for more interest. Some ways to enhance social skills include practicing role playing. So you model interactions and different types of play in order to practice situational interactions. Coordinate structured play dates. With structured play dates, you will want to have activities prepared that your child can engage in independently, or simplify the activity so that they don't need a lot of assistance from the adult. This will help keep the focus on peer interaction, and instead of asking an adult for help, maybe they ask their friend for help. For those who may be a little more advanced, fun board games are a great way to promote group activities. Musical chairs, having a dance party where they follow along to videos, which would require the imitation skill, or even circle time are all fun and interactive. So remember that it may take some repetitions for your child to engage in these group activities, but it's important that you keep trying. And it does help to use their favorite toys um, to pair with these activities. Now, moving on to managing behavior. This is a complex topic, so I'm going to do my best to provide enough information and tips to help you manage the behavior, but also provide some insight as to why your child might be engaging in the behavior to begin with. Some things that are important to pinpoint are the triggers or precursors to the behaviors. So, what is happening just before that challenging behavior occurs? You can ask yourself, can I change the way I remove an item from my child so that they don't throw a tantrum every time an activity has to end? Maybe by giving them the opportunity to hand over the item instead of us taking it from them, we avoid a tantrum. Another strategy is using the first then statement. So saying, hey, first we need to read, and then you can get your iPad. These would be considered proactive strategies. Automatic reinforcement is one of the 4 functions of behavior. This means that they don't need anything from anyone, like they don't need that social interaction or an item for them to continue in a behavior. So, forms of stereotypy are typically maintained automatically. So, as far as sensory needs go, am I stopping them from engaging in their stereotypy? Remember that stimming or stereotypy typically occurs when they are feeling happy or showing indications that they're happy or content. So, am I stopping their happiness? In my opinion, and what I try to tell parents is unless the stereotypy behavior is a barrier to learning or harmful to the kiddo, I will not try to eliminate that behavior altogether. We all have our own stims. I constantly bounce my leg when seated. So I challenge all of you to figure out what your stim or form of stereotypy is. Sometimes self injury is a form of stereotypy. I'm not sure I understand it because it looks painful, but I know I have seen some kiddos who beat on their chest repetitively, and it's not because an instruction has been placed or they're trying to escape from a certain demand. But that would probably be a form of stereotypy. I would interrupt. Um, it's painful. It can cause injury, but like I don't have autism. I won't wear certain materials because I don't prefer a scratchy sweater and I hate tight tops. Everyone is allowed to have their preferences. So take into consideration the sensory needs that your child has. Moving on to positive reinforcement techniques. I don't encourage you to only engage in conversation with your child when they do something wrong. Provide praise throughout the day, even if it's for the most simple tasks. Throw a party and get excited and be loud if that's what your child is into. If that's what makes them happy, is seeing you get all excited for them. Some kiddos might not like that though, and so instead you might offer a toy. I'm not saying go buy toys all the time, but like switch out items in your home periodically. Um, and then you can even provide fun snacks from time to time. Don't do a whole bag of M&Ms, but like maybe a couple here and there. Also ask yourself how often you're giving this praise. Some kids may need very frequent praise. So for every one correct response or appropriate behavior, which is what we consider an FR1 or fixed ratio, I'm going to give a fruit snack. For example, I tell Sarah to touch her head and she touches her head immediately without problem behavior. Boom, I'm going to give her a fruit snack. Now, for more advanced kiddos or kiddos who will just tolerate longer bouts without praise, I might set a timer for a random duration. And as long as they're engaging in appropriate behavior by the time that timer goes off, I will give them a few minutes of a break, or offer to play with them if that's what they're interested in. Going over FR1, VR, and VI that you see here, those are considered schedules of reinforcement. They can get just a little tricky, but if you guys have any questions on that, I can definitely go over that at the end. It's also really important to develop coping strategies for anxiety and meltdowns. Some examples may be to provide sensory item, practice breathing exercises, provide time alone if that's what they prefer. But if they have engaged in a challenging behavior and you provide that quiet time after, I do suggest that you maybe follow up with a talk, so that they understand the behavior they engaged in is not okay. And then when they're calm, you might provide a lower preferred item versus a high preferred item. Another technique might be to go for a walk or play some calming music. And lastly, create a supportive environment. Managing behavior can be exhausting. Be available to support your kiddo, but you have to take care of yourself and make sure that you have support too. Also, make sure that you still provide attention to your other kiddos if there are others in the home. When they learn that Sarah gets attention for all of the tantrums and challenging behaviors, you may see your other kids begin to act out because they've learned that that's what gets your attention. I'm not saying it's easy because I don't even have kids of my own. I consider my clients my kids, and that's good enough for me for now. But I can only imagine how hard it is to manage everything. And that's why your support team matters. And that's where collaborating with professionals will help. Part of your support team are those who are involved in your child's learning. Use them for knowledge, ask questions, participate in trainings. You should be offered trainings. Ask to observe a session here and there and learn what skills are being worked on. For the kiddos in school, they may have an IEP or individualized education plan. These are meant to provide support, goals, and accommodations if needed. They help create a collaborative environment amongst everyone who is involved in the child's learning. Goals are based on strengths and weaknesses. They give your child access to speech and OT professionals within the school, as well as legal protection. When your child has an IEP, it has to be followed. I am not an expert on IEPs. A lot of my own clients are just younger and haven't transitioned to school. So I am not an expert, but I do know that IEPs are very important for that transition. Now, really quickly, I want to show everyone some resources and provide ideas on where you can find additional support. Autism Speaks is a fabulous resource. It provides so much information where you can gain more knowledge, but they also have a blog. Facebook has some great support groups. I listed a few here for you. Instagram, you can follow ABA professionals who will share the ins and outs of the field, but you might find that they also provide materials for purchase, and sometimes you can find some free materials too. TikTok, I personally love TikTok and will doom scroll, but you can follow families of kiddos or adults with ASD and learn that you're not alone because these other families are experiencing similar situations. Or reach out to other parents of clients within your child's clinic. Maybe your kiddo has a bestie when they go to ABA. So at drop off or pickup, you're able to communicate with this family and set up some play dates, which then leads to more social interactions. And here is where we come closer to an end tonight. I hope I was able to help you understand the key aspects of ASD, including its prevalence, signs and symptoms. This presentation also explained the differences between high functioning and low functioning autism, offering insight into communication strategies such as PECS and AAC devices. I hope you also learned effective approaches for supporting social skills development and managing behaviors to help your child thrive in all environments. So thank you everyone for joining. I encourage you to continue learning and seeking support. Your participation is appreciated, and remember that even if it's just a little bit of progress, progress is still progress. Here are some additional resources with links. These are fun blogs that I found. This one at the bottom here is an article with even more blogs for you to search if you're interested. So now we can open up the floor to any questions.
So again, if you do have any questions, go ahead and just type those in the chat and we will go ahead and answer. Also in the chat, I dropped the link to the page on our website, so the autismclinic.org/autism-workshop for the full one. This is where we will be posting the recording of tonight's presentation. Give me a couple days to get it downloaded from Zoom and then get it back up onto our website. But you can also go to this page. We do have some other workshops that will be coming up in the coming months. I don't have dates on them yet, but we will, again, in the next few days have dates, and we'll probably be opening up registration about 30 days out for each of those. So any questions, feel free to go ahead and drop those in the chat. We have a very quiet group tonight.
Yeah. I can't see anyone. Can you tell me how many folks?
I'm sorry?
How many folks do we have in here?
We have 5 attendees.
Okay.
So If nobody has any questions now, that's fine. You might want to stop and think about things. If you have questions later, you can always go to the autismclinic.org and use our contact form and reach out to us and ask questions. We will be more than happy to answer those for you. But if you don't have any questions, I guess this is where we say goodnight.